Having surgery comes with many questions, but here we will review some of the most common asked breast surgery questions. For more specific details pertaining to the type of surgery you will have, please refer to the appropriate video and patient handouts for more information. What post-op symptoms should I call about? It is very normal for your breast to feel different after breast surgery. Please reach out if you develop any of the following: any signs or symptoms of infection, which include a fever greater than 101 degrees Fahrenheit, chills, nausea, vomiting, redness or tenderness at or around your incision site, or if there is a foul-smelling discharge coming from your incision. If you have any worsening breast or axillary pain not relieved by Tylenol or narcotic pain medication, any worsening or darkening bruising in the surgical area, any limited range of motion in your shoulder, or any pain or discomfort associated with a seroma. Seromas, or pockets of fluid formed within the surgical cavity, are common after breast surgery and are part of the body's natural healing process. Most symptomatic seromas develop under the axillary incision with a circular area of swelling. Most seromas go away on their own within 3 to 4 weeks after surgery. We recommend you reduce your activity and use extra compression to limit the accumulation of fluid until it resolves. If you are experiencing pain from your seroma, it continues to increase in size, or there is a concern for infection, call your doctor and an aspiration may be recommended. An aspiration is a quick procedure performed in the clinic under sterile conditions where a needle is introduced into the seroma cavity and the fluid is drawn out. The whole procedure often takes less than 5 minutes. It is very common after axillary surgery, including a sentinel lymph node biopsy or an axillary lymph node dissection, for you to develop discomfort in the axilla and the upper arm above the elbow. During the procedure, we disrupt a lot of the superficial nerves under the arm, and until they heal, you can be left with intermittent shooting pain, discomfort, and/or numbness. We recommend Tylenol, Advil, ice packs, and stretching as needed for symptomatic care, but anticipate as your body heals over time, these symptoms usually resolve within 6 to 8 weeks. Although, in certain cases, the loss of sensation can be permanent. If your surgeon injected methylene blue dye into your breast to help find the sentinel lymph nodes, it can cause nipple pain for a few weeks after surgery until the blue dye is absorbed by the body. It can also be normal to have a small area of firmness where your breast surgeon injected methylene blue. We recommend NSAIDs and ice packs as needed for symptomatic care. But if you develop any skin breakdown, rashes, or signs and symptoms of infection, please contact your surgeon. All of your stitches will be under the skin and dissolve on their own. But on the skin surface, you will have either skin glue, which is a purple color, steri strips, and/or gauze and tape covering your incisions based on your surgeon's preferences. It is okay to shower after 24 hours, although if you have immediate breast reconstruction, your plastic surgeon will inform you when it is safe to shower. While showering, you can gently wash over the area even while the steri strips are attached with soap. Let the shower water run over the area, then pat dry. Leave skin glue or steri strips on until they fall off on their own, which can take about 2 to 3 weeks. Do not submerge your incisions in water, such as a bath, a pool, hot tub, lake, or ocean, until you are well healed and you have discussed this with your surgical team. We do not recommend that you use any particular lotion, cream, or supplement after surgery. It is safe to resume your regular practice with lotions and/or moisturizers to the area 3 to 4 weeks after surgery. Some patients prefer vitamin E oil at the incision site. It is often helpful to massage the scar during the healing process to help minimize the firmness associated with scar tissue. It is safe to start massaging the area 4 to 5 weeks after surgery. Depending on your type of surgery, your team will ask you to limit exercise anywhere from 2 to 4 weeks after the procedure. We recommend you avoid lifting anything heavier than 5 to 10 pounds with the arms and to avoid activities that jostle the breast, such as running, jogging, or using an elliptical machine or Stairmaster. Lymphedema, or swelling in the arm and/or hand due to a disruption of your lymphatic drainage, is uncommon but may occur in some patients who undergo a sentinel lymph node biopsy, axillary lymph node dissection, and/or axillary radiation. Symptoms include hand and/or arm swelling and arm heaviness. An often first sign is that your sleeve, watch, or jewelry feels tighter than usual. Most cases occur in the first year after surgery, and being overweight can increase your risk. If you suspect lymphedema, contact your surgical team, and a referral to a physical therapist and/or a lymphedema specialist is often recommended in some cases. There is no evidence that these will cause lymphedema, and it is safe to have these tests performed in either arm. However, your preference on usage and selection of the arm for these tests should be respected. Research shows that you should avoid blood draws and blood pressures in the arm only if you have been diagnosed with lymphedema or have a history of lymphedema in that arm. Yes, it is safe to have a massage after breast surgery. Research and clinical experience show that it may help with symptoms such as pain, anxiety, depression, fatigue, insomnia, and nausea. Massage therapy is offered at the Leonard P. Zakim Center for Integrative Therapies and Healthy Living at Dana-Farber Cancer Institute by calling 617-632-3322. Most studies do not suggest that particular foods cause or prevent breast cancer. However, diets with starchy foods like broccoli, cauliflower, tomatoes, and zucchini, as well as the Mediterranean diet, have been linked to a lower risk of developing breast cancer. Additionally, research shows a strong link to alcohol use and breast cancer. The American Cancer Society recommends that women consume no more than 1 alcoholic drink per day. After breast-conserving surgery, also known as a lumpectomy, we continue to recommend annual mammograms as mammograms continue to be the best screening tool for detecting breast cancer. Your treatment team will help you determine the timing of your next mammogram and will help set this up for you. After a mastectomy, there is no need for routine breast imaging, but if something is found on physical exam, a breast ultrasound may be performed. Of note, if you have a unilateral mastectomy, we will continue to screen your other breast with yearly mammograms. Any woman who is interested in learning more about her risk of breast cancer should contact our Breast Cancer Personalized Risk Assessment, Education, and Prevention Program, also known as the B-PREP program, at 617-732-8111 for more information. As stated earlier, having surgery comes with many questions. Please do not hesitate to reach out to your surgeon's office with any additional questions regarding your care.